So, welcome today to Gaule's Question Time. I had the pleasure of being joined by Lily from Jack Fertility. Hi, Lily.
Hi, thank you so much for having me. Pleasure to be here.
Great to be with you. Now, we know each other through the University of Oxford's AI network, where we're meeting sort of quite often, and it's a pleasure
Yes.
to now have you to talk about your venture. So, it'd be great if you could do a brief introduction to yourself first, and we'll get into the detail of the venture.
Yeah, absolutely. No, I'm so glad we could finally make this happen. And yeah, AI. I previously was at an AI drug discovery company, and that was part of what inspired what ultimately became Jack, is really thinking about the lack of data and male fertility. But it's all in the name, right? So I am Lily Elsner, CEO and co-founder of Jack Fertility, which is trying to tackle the big issue of male fertility in the UK and remove all of the barriers to male reproductive health care. So the what we've built is a mail-in sperm test, which allows men and people with sperm to send in their sample from home and then get all of the information that they would have gotten from a clinic, as well as importantly, the next steps on how they can optimize their sperm health. So we started this in Oxford about 2 years ago, and I've been in Oxford for 5 years, as you can tell, even though the American accent may seem local to Oxford sometimes. Originally from the US, and yeah, have been loving being here ever since.
Great. So the stage of your business, where is Jack Fertility
Mhm.
in its sort of development as a startup and that then?
Yeah, so we've been working on Jack for about 2 years, and we have this full working MVP. So we have the physical box itself, all beautifully branded to be very discreet. But importantly, we also have all of the back end tech. So for those of you who can't see the kit, it's been designed by so many different points of user feedback, as well as by fertility experts, that we needed to make this as easy as possible. So after interviewing hundreds of individual users, as well as different various types of fertility clinics around the world, frankly, we discovered that really why men don't get tested is because it's such an off-putting experience. It's really stressful, especially when you go on the NHS to get tested. You often have to, well, to be qualified to get a male fertility test, you have to actively try and conceive for a year and then get on a wait list.
Mhm.
You then are assigned usually a random date and time during your workday. You have to go and then be asked to perform either in a sample room or in a disabled bathroom, and only have a little bit of time to be able to give the sample and then ultimately get results that you often don't understand. It's a similar experience on private clinics, but the really big picture reason why men need to get tested is that male infertility is responsible for about half of cases of infertility. 1 in 6 couples will experience infertility at this point, and the numbers are only getting worse. And so they're unlike female fertility, so there are a lot more tests that you can mail in, lots of blood tests, that sort of thing. And I say this as a woman, right? It's very difficult to change anything about your fertility with the female body. On the male side, however, there is so much that can be done, and male infertility is highly treatable with a mix of lifestyle changes, mitigation of exposure to environmental factors, as well as occasionally some more serious medical interventions. So really, that's where it was the mix of really revolutionizing the user experience to make sure that men were not being off-put to get tested, and also then saying, actually, once you get tested, there's something you can do, was really important to what we were building with Jack.
Yeah, I've had personal experience of that trying to start a family and sort of being through that process. And I think seeing Jack Fertility and the stats you've got on there and some of the background I've been seeing, yeah, it sort of brought it home to me that the female is the one that ends up having most of the stuff done on, and it's the most expensive, and
Precisely.
the relatively cheap sperm test, and as you're saying, being able to make that simpler to remove those sorts of barriers, and then the intervention that could be done on half of the couple to be able to improve the chances seems to be a much more productive way and a lower cost way and a less invasive sort of way than IVF and all sorts of other things that the other partner has to sort of go through. So you're finding now that with the professionals and the NHS and with customers, patients, How are you finding the reaction to the service you're providing?
Yeah, well, first of all, thank you so much for sharing your experience. And also, yeah, it's been an amazing response because I think so many people, one, this is such a stigmatized area that many people have gone through this, and the stats really don't lie, but it's something that people tend not to share, or it's something that has been suffered in silence. And it really leads to a lot of people needlessly going down the IVF route, which not only puts a huge burden on the NHS if you qualify
Yeah.
fertility as a postcode lottery. There are so many other issues that you never know until you're suddenly in this position. So you spend most of your life trying not to get pregnant. And then all of a sudden, when that switch happens, there's so much you wish you knew. And that's something that's a much larger societal issue that I think we're trying to contend with. And again, part of going direct to consumer and with the name being a bit cheeky and really making it approachable so that people can have some of these more vulnerable conversations is a big part of our mission. But to your question about receipt, I think that's again part of why we're going direct to consumer is because so many people don't want to have to contend with some of the providers. It's really scary to even go to a fertility clinic and even utter those words in many cases. And so to be able to do it from home entirely discreetly, I think there's a big use case for not only people who are actively trying to conceive, but much more importantly, and from a bigger picture, both revenue perspective, of course, showing my background as an Oxford MBA, but also from that societal perspective is allowing people to test way before they're actively trying to conceive, thinking about after you get married, or if you're maybe not in a heterosexual relationship, thinking about your family building process and being able to sort of start that conversation much, much earlier, especially since sperm count is down almost 60% over the last 50 years. So people are starting to become much more aware of these issues. And to your question about the NHS, we actually did the Hills Pre-Seed Accelerator last year, and that was an amazing opportunity to get insight into the NHS and how this is viewed. And I think, of course, we all will have our different experiences with the different aspects of the NHS, but unfortunately, there's just so much burden on people trying to access these services as well as on the NHS to provide them that longer term, I think there will be a large appetite for this in the way that remote STI testing became quite popular, partially for patient experience and partially for getting people to actually get tested and getting a lot of these issues looked at. Fertility clinics actually were the biggest surprise in the spirit of sharing the venture building journey is that we actually went when we very first couple of weeks we went to fertility clinics and said, hey, do you want to develop this with us, or like what is your reaction? And they actually said, we want to buy this from you because it's a really big burden on them to have to do in-person
Yeah.
so for them, they're spending their full-time employee time on trying to get the folks tested. And it takes away from the more sophisticated treatments that frankly, the embryologists who do the tests want to be doing. They'd much rather be doing that from the fertility clinic business model. They'd much rather be focusing on those much higher margin tests. And so it actually was a really great positioning
Yeah.
to be able to look at that and also have some of those B2B opportunities as well.
And as you said, the customer experience of being able to do it in the home, be able to do it when it's convenient and that for you and when it's appropriate, and then you taking that burden for the customer, the user, and for the intermediary, your partner, and that is going to be phenomenal and very relevant. So right,
Thank you.
let's get into the startup sort of thing. So
Yeah, sure.
your MVP, you've got a minimum viable product,
Yep.
you've got the testing, and you've got the lab all sorted out because it's not particularly cutting edge tech, is it? It's you're just doing the stuff that's been done and tested for some time, or are you doing something different in the process?
Yeah, so thanks for asking. It's sort of a deceptively simple test, but the really important piece where the tech is for us is that normally sperm dies within an hour of leaving the body. So this is why it has to be in person. And to be able to make the postal test work, it was really important to make sure that we could get the sample alive to the lab. So that was what we did about 5 months and hundreds of samples in the lab. So we have a lab at the Wood Center for Innovation that we built out and tested all these samples under lots of different conditions, and ultimately tried to make sure that one, that we get really accurate results. But it's very difficult to keep that sperm alive. So we've built out an aging algorithm that predicts what the quality of the sperm would have been to make sure that we're giving people the same results that they would get in a clinic. And so that was the novel tech that we've developed and can ultimately be more of a licensable software that we could use to go B2B or that sort of thing. So there was a significant amount of tech development that needed to be done to make this possible. But that's what we've cracked, and that's what we're only going to get better as we launch. And I can also mention too, in the spirit of AI and how we sort of met, is that we have a longer term data play to be able to do much more interesting R&D work on male reproductive health. So that's where we get really excited, is that there is so little data that's collected on this. It's not really a statistic that's tracked within the NHS. We only really don't know about how we don't even know how many sperm tests are done per year. And it's not in the biobank. It's not in many of the other like larger healthcare systems around the world. And so we see this as a really exciting competitive differentiator, is that because we have our own lab, can look at a lot of this insight. And customers have been really excited about sharing that as well, to be able to sort of get to the heart of some of the larger, huge fertility questions. And again, as a former scientist myself, I get really excited about this actual frontier of really being able to pioneer some very cool research that could have really wide-ranging effects.
And in terms of regulation and clinical sort of efficacy and sort of stuff like that, what's are these things sort of managed, controlled? Have you got predictive parameters you're trying to hit, or is this not that well, covered at the moment?
Yeah, well, so that's the kind of bizarre thing about that we found. We've talked to over 15 regulatory consultants trying to make sure that we have freedom to operate. We've talked to loads of different fertility specialized law firms. And what we found, it just speaks so much about the perception of fertility and frankly, gender, is that one, because, sperm is a lot easier to access than eggs. And so it's a little bit less high stakes in terms of the samples themselves. But also because what we're doing is not actually conception work, it's much less regulated because it's simply just an assessment. And we're also not doing genetic testing, which also really de-risks what we're trying to do here. In terms of it, though, it is a bit scary, and I think especially operating in the UK, we are a very risk-averse culture, and because it's not really defined, part of that we see as the entrepreneur's mind says, "Okay, this is really exciting, freedom to operate, and an exciting way to go into it." But from an investor perspective, can also say, actually, something could go wrong. And I think my argument is things always go wrong, so it's
Yeah.
best to act.
Okay. Good. Good. Can you tell us a little bit about the team then? There's yourself and
Hmm.
your co-founder Nick, and what's the
Yes.
background to the two of you and the team?
Yes, yeah. So the Jack origin story really actually begins in 2019 when Nick and I met on the first day of the Oxford MBA. So very first people even met on campus. We were in the same study group. So he was very kind, polite British person listening to all of my ignorant American questions.
No,
But
not you're stereotyping any of us. No, no,
no,
no.
not at all. But yeah, we became really fast friends and worked on a lot of different academic assignments together and realized we had such complementary skill sets, interests. And but this was going into March 2020 when I, of course, was locked down, as we all were, but I was locked down in Pembroke College and continuing with my MBA coursework. And on day one of the MBA, or sorry, day one of lockdown, Nick and his wife had to go to the hospital and deliver their first baby, which was
Oh,
super
wow.
exciting. Yeah, there was a lot to navigate there. So when they welcomed baby Erin, she went home with them and they had to navigate being brand new parents in the middle of a pandemic. And understandably, Nick deferred to the following year. And so I ended up getting hired in my growth stage startup role. Started getting back into biotech after having spent my early career in first big mergers and acquisitions in New York City, and then in financial services in outside of Washington, D.C. at Capital One Bank. And had thought I was going to go actually into London here and do a similar role, but I actually really rediscovered my scientific roots through working with biotech startups in Oxford and realizing I could speak science, I could speak corporate and translate between the two, which is actually a very, frankly, quite useful skill set. So Nick returned to Oxford to finish the MBA, and he was trying to get tested at that time for trying for their second child. and couldn't get access to it. And part of that was lockdown, but also you were popping PCR tests through the post. There are really exciting femtech players like Fertility and some of the other remote female fertility testing companies starting up. And he approached me as the science friend and said, look, why can't I do this through the post? Why do I have to go in person? Why is it taking so long? And my immediately I was like, this is ridiculous because honestly, livestock and animal conception happens through artificial insemination through the post many times.
All right.
Why
Okay.
couldn't we even have something like this solely for testing for people? And that kicked off about 6 months of developing what ultimately became our scientific team, running around Oxford and the greater UK, asking anyone who is sort of foolish enough to answer our emails, saying, why is it like this? So we spent about 6 months talking ourselves out of doing the business because we were like, surely we didn't come up with this.
Yeah. Yeah. Yeah.
And then discovered actually we were the perfect team with Nick's background. It's fast moving marketing. My background is building consumer facing products as well as biotech. And then our larger scientific team's passion for fertility and reproductive medicine. And then just kept building amazing true believers from there. So, like, we have an incredible marketing team in London who've been helping us with all our branding work, really trying to straddle that line of making a brand that's appealing to men while also knowing that actually a lot of the purchases will be made by women for their partners. So, that was an
Right.
interesting
Okay.
insight as well.
No, fascinating there, and particularly the balance you've got within the team and that there, the complementary sort of sides of the two, and I think the point you just made there about, well, why has nobody sort of done this before, and having that challenging yourself, I think is a great point for other sort of entrepreneurs, but then having that determination and focus and that on, before I've seen about you and I've seen about Jack Fertility, almost like keeping it simple as well. That's a sort of fair view and all that, and not making it over
Absolutely.
complex, I think is the key message I seem to get a lot of the time with when I meet you and when I see the product and when I see the process you're doing.
I really appreciate you saying that because that is so intentional. I mean, it's so, especially when you're in such an interesting area of science, it's so easy to fall into the trap of talking about all the super interesting things that are happening on a medical perspective or on the environmental perspective or whatever it is that's so interesting. But I think really, and part of that is a credit to Nick's background in consumer insights, but also what we found in so many customer interviews is that people say, especially when they're worried about this, the last thing they need is a bunch of scientific jargon or people trying to explain. Often, especially when people have been through fertility treatment, what they say is that they're like, I didn't want to get a degree in embryology, but I ultimately did to even understand what was going on with my own body. And I think that's really, if we're thinking about the one pain point that we're really trying to solve with Jack, and again, part of why we even named that is to make it as simple and as easy as
Yeah.
possible to understand where you are and where you want to go and how to get there.
Yeah, and going back to my experience as well, it's like, yeah, you go into all that science of IVF and all of that sort of challenge. It's like, well, but why haven't you done the simple stuff? The sort of the
Precisely.
perspective sort of stuff that I was sort of, it's like nobody's actually asked the question of, are you doing the sex right? Are you
Right.
actually? Yeah, it's like I was like, how do people know how often you need to try and when you need to
Mhm.
try and all the rest? It's jump to the science and go to the clinic and sort of stuff like that. It's just so fascinating in that what you're sort of covering. I do want to cover the gender and sort of
Sure.
diversity issue. I'm
Mm.
interviewing lots of female founders, female angels, and sort of stuff like that, just because they're great people and they're doing great stuff. But I'm also a great believer in diversity, in that people are different, people bring different skills, and what we're not looking for is for everybody to be this archetypal, in inverted commas, chief executive or founder or investor. We're looking for diversity and difference.
Mm.
So I'm interested in I suppose, why does it take a female to sort out a man's problem? So have you got any
That's a
perspective on that? Because mothers, wives, daughters do sort out men's problems. So why does it necessarily take a female to do that?
That is beautifully put. And I so appreciate you acknowledging that it is so often the case. And I think one thing, and I certainly don't want to generalize, but I think Jack is a wonderful use case of precisely what you're describing with diversity, is that it could only be this way because we have such a great team with so many different perspectives. I think again, and even what I was mentioning about the purchasing decisions, I mean, most of the purchasing decisions around healthcare are made by women in the family. So that was one piece, especially just with our MBA revenue hat on, we're thinking, okay, who's actually going to buy this? I mean, I
Great,
can
great, great point. Great point.
right? You know, I'm like, I could make Jack, you know, the coolest brand in the world to appeal to all men. And I'm not sure how good our revenue is going to look versus if I say actually acknowledging it, who's really driving. We often say at Jack is where the women are the CFOs, the chief fertility officers, as well
Right.
as
Okay.
often the chief financial officer of the family. And so also, similarly, men are not going to go to a clinic. It's really tough to get folks to engage with healthcare. And we've done that really came out so strongly with all of the both healthcare practitioner side of things as well as individuals themselves sharing how they interact with healthcare. And so we realized we could try and beat them, or we could try and join them and say, actually, look, we understand and acknowledge and have I think, especially from just lived experience, we find there are certain ways and patterns that we see where people's the way they think about things can often fall on gendered lines, or at least the vast majority of them. And so, especially, I mean, when we kept hearing again and again, like, I'll do it if it's easy, we're like, well, we'll just make it easy then,
Yeah, yeah.
and sort of acquiescing to it. And I think as one of the only female CEOs of a male fertility company, frankly, in the world, but definitely in the UK, what we often find is that there is a tendency to be focused on, because men are coming from their engineering backgrounds or from their STEM backgrounds, they're so focused on the tech and often not really focused on the end user because again we fall it's not it's if there isn't an advisor there, somebody that's helping them understand, sort of guide the development to how do people actually interact with this. It's really important, especially when you're trying to tackle as big of an issue as men not testing, which is important to drive your business model, as well as to drive the tackling of the massive societal issue. You have to meet people where they are and understand that. And I think that's something that women are, I wouldn't say uniquely because I think it's so common, but
There's people in all sorts of spectrum and got the different traits, but and that's why as I made the point about I celebrate diversity that people are different through
absolutely.
gender, through life experiences, through race, backgrounds, or whatever like that, and we should celebrate that, not expect that. Oh well, we're solving diversity by making everybody the same sort of type thing. So
Yes,
oh,
yeah,
that's it.
definitely. Absolutely. And really finding the way for people to thrive. I think that's the
Yeah,
other thing is really finding where those things are helping build a better product or build a better team or build a better thing
yeah.
rather than trying to focus on how it holds us back.
So back to the business.
Mhm.
When are you going to make revenue?
Mm.
What sort of investment and that are you looking for? What's the business sort of side of it?
Yeah, absolutely. So we're really excited to hopefully, but we're committed to launching next year. The struggle, I think, with something like what we're doing is that when we say direct to consumer to hopefully anyone listening to this, UK investors, immediately are like too risky, which I hear. Consumer health is not exactly in fashion. But it's incredibly important for us to go direct to consumer to get the consumer feedback on these boxes before we start going B2B. We've seen a number of companies try and go B2B first in this space and or anything even vaguely around male fertility, and it's just not there from a user perspective. And so we want to make sure that we find that product market fit and have the agility to be able to do that and iterate and make sure that we're actually able to deliver a product that then can be scaled. Which is frankly, especially when you say I'm going to do direct consumer with a hardware component, can be a bit scary in the age of B2B SaaS and
And
AI, dare I
you
say.
do wait lists at the moment then? Can people
We
sort of
do.
price?
We have a great wait list. We have over 2,000 people have signed up since we launched that in
Yeah.
the middle of this year. Covered by Sifted, actually. Nick Shipley, my co-founder, got to go and he actually had a wait list for his roundtable about that. So that was really exciting. And in terms of getting it to market, so as I mentioned, we have the MVP. There's a little bit more R&D work that we're working on just because, again, it's fertility. We can't move fast and break things in the way that the rest of tech can when we're talking about something as important as this. So we're just trying to make sure that is as accurate as possible, as clinically validated as possible before we launch. That's also not to say that we don't have the wait list, and we have a lot of excitement happening, and we have a number of pilots that have been running. So really getting to, again, get that good user feedback in the meantime. And the path to revenue is really just we have a number of these kits ready. Once we have the final bit of tech really ready to go, yeah, we'll be off and running. So
Right.
I'm like, do
And
say sign up to the wait list.
in the startup, what you're doing investment raise. You've got a runway in that at the moment, but you're actively looking for investors who want to contact you. You're happy for that?
Yes, no, we're always happy to have a chat, and especially people who see the vision and understand the big picture thing that we're trying to tackle. So last summer we raised with Founders Factory and the Reckitt Keyser accelerator that they have, which was fantastic because the Reckitt owns Durex, so really interested in the consumer insight side of things, and
Yeah.
especially because this is a nascent industry, men caring about their fertility and really tackling the space. We have this amazing first mover advantage. And sadly, the sort of big wave is about to arrive in terms of people getting to that point with the amount of infertility that we're seeing, sort of devastating state of affairs for male reproductive health care is really getting worse. And so that's really where we've had a lot of success with not only Reckitt and some of the actually European funds. So we've had a number of fantastic investors from Italy, where the birth rate is really front of mind, and a lot of success with angels who either get really excited about the consumer side of things or have really like genuine excitement about the possibilities of what we can do in the longevity space, because sperm is such a good biomarker of overall health, and really understanding how we can use that in concert with and especially monitoring in the age of GLP-1s and some of the other big hot areas within health tech. So yeah, any angels, funds, family offices, please have a chat with us because we'd love to
Fantastic.
join us on the journey.
Fantastic. Lily, it's been really good to talk through with you. So it's always lovely to meet up with you at the Oxford AI sort of session. So we'll look forward to seeing you that there again. And I
Absolutely.
keep calling you Jack every time I see you,
I know.
I'm still going to call you Jam. So lots of people do, Lily.
I do. I
Lots.
answer to Jack, don't you worry.
So it's been lovely chatting to you. Thanks very much for sharing your story and the story of the venture, Jack Fertility.
Thank you so much, Andrew. It's been an absolute pleasure.